Hello, assalamu alaikum, ladies and gentlemen. Welcome to yet another episode of the Dental Talk. Today we have a very special guest. I've been trying to get him on the show for a while. Today we have Dr. Yawar Hayat Khan with us, who's a graduate of De Montmorency Dental College. He has been in dental education for the past 21 years. He has more than 20 years of teaching experience at both and at an undergraduate and in postgraduate level. He did his dental research masters from the Queen Mary University of London in dental materials, and then he went on to do his masters in health professional education from the University of Maastricht, Netherlands, and did his PhD in medical education from the University of Ambrosiana in Italy. So, we'll be talking a lot about medical education and dental education specifically. Dr. Khan has presented at various conferences and has held key positions at both at a national and an international level. He is currently working as a Deputy Vice Chancellor at the Rifa International University and has served as the Vice Principal of principal of the Dental College of Rifa as well. He has held many board positions at international dental colleges as well. He's part of many international and national associations as well. I could go on about his leadership and all his credentials, but it would take me a while. So we'll just get into it. Assalamu alaikum, sir. Thank you so much for taking time out. I hope you're doing well.
Yeah, Walaikum Assalam, Dr. Ghulam Ahmad Pracha. Thank you very much for inviting me, for hosting me, and it's a pleasure.
नहीं सर, थैंक यू सो मच सर। जब हम लोग अपने इंस्टाग्राम पर पूछते हैं कि किसका इंटरव्यू करें, तो अभी सम टाइम बैक जब हमने पूछा तो काफ़ी लोगों ने कहा था कि डॉक्टर यावर हयात खान का करें. दे फेल्ट दैट you'll have some very unique insights into the questions that we had. So I'm really excited for this conversation. I've been looking forward to it, and with your permission, can we start?
Please, likewise, the pleasure is all mine, and जो भी मुझसे हो सकेगा इंशाल्लाह in my all humble capacity. So I would like to share my experiences with you and with your audience, please.
Thank you so
Go
much.
ahead.
Sir, थोड़ा पीछे जाते हैं. When did you decide that you wanted to be a dentist, and how was your journey through dental school? 4 साल डिमॉन्ट में कैसे थे आपके?
Well, looks only yesterday,
अच्छा.
but it's one of the beautiful memories that I've ever experienced. Just to tell you honestly, becoming a dentist was never in my mind actually, and as always, I thought that I should become a medical doctor. But I think going to dental school and then getting stuck there it was more of a, I guess, fate and destiny, because it was a time when I applied for the medical schools, and in the first list my name was not there, so I was waiting for the second list, and usually it takes around 3 to 4 weeks, and sometimes a month, 2 months maybe. So my father, my late father, who was my mentor as well, and he was my best friend, so I used to discuss each and everything with him, my career goals and everything. So he advised me, suggested me that meanwhile, when I was waiting for the second list, so he said that why not to go to the dental school and just you can join there, and meanwhile make some friends and just experience this new thing, dentistry. And so I just I asked him that he should promise me that whenever my name will come, so he will allow me to come back to medical side. So he said, fine, go ahead. And being Lahore, my hometown as well, my grandparents were there at that time, so I was a bit excited too. So that's how I went there. I joined the dental school, and very quickly I got adjusted. And if you ask me that what was that trigger, so I think it was two things. First and the foremost, what I saw was that whenever because when you're treating a patient, and we used to see when our seniors were doing patients, so when you are treating a patient and the pain is resolved, because you see the results immediately, right? Because in other fields, when you treat a patient, he goes back and takes some time.
Post-op, yeah.
Exactly. So in dentistry, it's not that. I mean, it's a bit different. So if you treat a patient over there, you relieve his pain, so immediately he's satisfied, he's happy, and you get rewarded by Allah Subhanahu wa Taala as well. And he in his eyes, you were a godfather, and what
Yeah,
to talk about.
that's true.
So that was the point. That was the thing I was intrigued by that, and also I think I should mention this thing. I've mentioned it a couple of times earlier as well. One of my favorite teachers, mashallah, she's still alive, and may Allah give her health. Professor Nazia Zdani, she's a prosthodontist, and
That's it.
she was a principal as well, and then she was principal of a private dental college as well. So when I attended her first lecture, so it was so amazing, and uh, probably that was the point. I just took her as a role model, and
Yeah,
I was so impressed by her lecture, by her wisdom, and her grip on the subject,
yeah.
that I thought that I should stay here. So I think that was the whole episode which happened.
परफेक्ट सर, दैट्स अ वेरी इंस्पिरेशनल स्टोरी। एंड पहले भी काफ़ी गेस्ट हमारे शो पे आ चुके हैं जो जिनसे जब पूछते हैं कि मेंटोर कौन थे, तो काफ़ी लोगों ने डॉक्टर लाहौर में तो स्पेसिफिकली काफ़ी लोगों ने डॉक्टर नाजिया यज़दानी का नाम लिया है। सो यस, शी इज़ अ प्रिटी renowned mentor in our.
Yes, definitely. Just to add on,
Yeah,
not only her, she was just one. As I just mentioned, she was just one immediate trigger.
yeah, yeah,
But I've been blessed, I think, to be taught by one of the, I mean, best of the best teachers
yeah,
in Demont. What to talk about? Professor Nazia Zdani, Professor Yusuf in operative,
yeah.
Professor Saeed in oral surgery, Professor Wahid in orthodontics,
Context, yeah.
and many others, many others. So I think
Perfect.
we were really blessed that Professor Adnan Shah, again in oral surgery. So in our time, they were our teachers, and we were truly blessed to have them
Absolutely.
as our teachers, as our role models.
Perfect, sir. Sir, आपकी you completed your BDS and then you decided to do your MSc in dental materials from the UK. Firstly, पहला question, why did you choose dental materials? And secondly, how आप फिर जब UK move हुए, you studied at Queen Mary. It's one of the best universities in the UK. How was that experience of studying in the UK?
Okay. Again, studying abroad was again one of my very old passions, that I should go abroad and explore that experience as well. So,
Yeah.
and my father was always supportive, and he said, "Ki bilkul aap jaएं, or you should explore." And to be honest, matlab, without any biases, uh, still, or I experienced it myself as well, that when I went there, their methodology, the way they taught us, and the technologies at that time, it was long, I think more than 20 years, around 20 years, 2004 I went there.
Hmm.
So they were far ahead than us, and it was a wonderful experience. I learned a lot during that time. And why I chose dental materials, again, it's a bit complicated. Again, it was not my first priority
Hmm.
to do a master's in dental materials, but there were a couple of reasons. I joined Rifa International University in 2001.
Mm-hmm.
And at that time, I observed that there was no subject specialist available in dental materials
Hmm.
since then till I went to do my master's.
Yeah.
So people used to, whenever it comes to call examiners for the exams, for the vivas, for
Yeah.
professionals, so they used to call people from allied subjects like
Right.
orthodontics, or maybe from
Yeah.
from operative, endodontics. So there was no subject specialist available.
Yeah.
So that was one of the reasons I thought that if I can do my master's in this subject, so probably I'll have the liberty and opportunity to come back and to develop the whole thing and to
Yeah.
establish the department. So probably I'll be one of the pioneers in
Yeah.
this domain. And that's what happened actually.
Yeah.
So
That.
that was one of the reasons. And secondly, my university was also of the opinion that when I talked to the leadership and my mentors over there, seniors, so they said that it's a good field, and if you do this master's right now, I
Yeah.
think it will be beneficial for the university as well, and of course for your career as well. Excuse me. So I think this was pretty much the reason.
Perfect, sir. That's clearly a very smart decision because वाकई में उसके बाद dental materials took off and They had many faculty positions over there. All right, sir. So, आपकी dental materials में you did your masters. You came back. You worked at RIFA for a while. Then you did your MHP from Netherlands, and then you went on to do your PhD. Now, आपने masters तो काफी पहले किया था in 2011-13 में मेरे ख्याल से. Now, clearly you were way ahead of your time. You were clearly way ahead of your time because मास्टर्स इन हेल्थ प्रोफेशनल एजुकेशन अब जाके इतना CHP का इतना रुझान आया है और MME का भी इतना रुझान पिछले 1-2 सालों में आया है जब से PMC ने ये रूल्स बनाए हैं दैट यू नीड टू बी अ CHP एवरी फैकल्टी मेंबर और इस तरह के रूल्स आए हैं. तो व्हाट गॉट यू इंटरेस्टेड इन मेडिकल एजुकेशन एग्जैक्टली?
All right. Uh, थोड़ा सा let me correct you a little bit with due respect that अभी it's not that कि 1-2 सालों में आया. It's the shift was started around a decade ago, maybe little more than that. So it was a clear paradigm shift, and मैं जब करके आया था, it was in 2005, and as I said, so I was excited to establish the department, to start from the scratch. So I hired people, I had budget in my hand, I started the department. I got promoted as assistant professor in dental materials, which was at that time it was an honor for me.
Yeah.
There were very few. In fact, Dr. Caffey, who
Hmm.
was the principal of Bakai as well,
And
and
I'm
he is
sure
in.
you must have been very young. You must have been 27, 28, or like
Yes, at
early
that time
30s.
I was 20 years old, 95. I was 20 years old.
No, no. When
So,
you became an assistant professor.
oh, I'm sorry. Yeah, okay. I was 30 years old.
Yeah, so
I
that's
thought you were
very
talking
young
about
for an assistant
getting into
professor.
BDS. Yeah, I was 30 years old. And at that time, Dr. Caffey was the only guy. He was assistant professor in dental materials, and he was working in Bakai at that time. So it was in, of course, I was excited, and as I said, so a couple of years. It took me a couple of years to just establish the department and hiring people, doing some research, and to get myself established over there, to write a few papers. Although it was difficult because I was always into administration as well. I was looking after the administration of the dental hospital. It was a full-time job too.
Yeah.
So, but again, as said, that Allah subhanahu wa ta'ala has been very kind always, and he helped me to cope up with these responsibilities, alhamdulillah, in all my humble capacity. So it took me a couple of years, and then again I figured out, because when I was teaching, so I was comparing uh, my methodology and the methodology which was going on around me with what I experienced in UK, in the West, and I found it totally opposite. So there was no open book thing at that time in Pakistan, and when we the very first day when we went there, they told us that they're going to be an open book exam for us. And then they also told us very clearly, they gave us the whole calendar and the start of the year. It was perfectly methodical, structured, and so
Yeah.
I was very much impressed by that, how they structured their program, how that master's program was organized. So I thought that why can't we do this in our domain, in our university, and in our environment, in our country? So when I looked for that, and when I researched a little bit, so then I came across this medical dental education thing. It was there too. It's not that it was not there,
Yeah.
but again, it was behind the curtain. So I thought that if we just do things in a structured manner, it will make a difference.
Yeah.
And that was the point I started doing more interactive lectures, not just the PowerPoint. I started involving my students more. I started giving them a few quizzes in the class. So maybe bit, you can say, a little bit out of the box thinking at that particular point of time. But so I started engaging students, and to be honest, many terminologies, they were not in my mind at that time. For example, student-centered learning, or
Yeah.
for that matter, teacher-centered learning. But these things I came across when I went to do my when I went to do my degree in medical education. But somehow or the other, I was doing these things, and later on I realized that what I was doing, it is structured, and it
Yeah.
has a name.
Yeah.
So
Okay.
that was the reason. that when I've researched a bit, so I came across that you can do things in a structured manner, and
Yeah.
there are different domains, and curriculum innovations are there. So there is no need to just stick to the traditional curriculum, and world is changing.
Yeah.
There are the curriculums are being changing. Now there are problem-based curriculums. There are different things. The world has started different things at that time.
Yeah.
So that was the trigger for me to shift towards medical education.
All right, perfect, sir. Perfect, sir. Many people, पाकिस्तान में काफ़ी जगह पे मास्टर्स हो रहा है, शुरू हुआ है इन हेल्थ प्रोफेशनल एजुकेशन और मेडिकल एजुकेशन. करंटली आपको क्या लगता है पाकिस्तान में एमएचपी या एमएमई का स्कोप क्या है, एंड वेयर डू यू सी इट गोइंग इन द नेक्स्ट 10 years?
Lovely, great question. देखें डॉक्टर साहब, it has a wonderful scope. I must tell you, because not that मैंने इसमें मास्टर्स की और पीएचडी की. अभी भी even when I went for my masters in medical education, because the first masters which I did it from my own pocket. So my father sponsored me. Next time when I was going for other masters, so there was a university was asking, it was an offer, you can say, from the university, that anybody who's interested, because at that time, as I told you, that not many people, they were interested to do masters in medical education, because it was not that
Yeah.
much, you can say, highlighted at that time. So university was sponsoring it, and it was an opportunity, and nobody was willing to take it. So I thought that why not, when I want to do it as well, and maybe it will create another window of opportunity for me. So I took it, and it was a sponsored program. The university funded it, and then I think when I went there, and again, just to tell you a little bit about University of Maastricht, because it's a Netherlands, and Maastricht University is a Harvard of medical education.
Oh.
And when I went there, I actually realized this thing, and it was totally, I mean, upside down, and the teachers and their knowledge, and these things. When I was doing my masters, this problem-based learning, case-based learning, flipped classrooms, and
Classrooms, yeah.
curriculum innovations. And so I mean, I found myself in a new world altogether.
Yeah.
And it was basically a hybrid program. We used to go 3 weeks full time in 1 year, and rest was online. I mean, then you were supposed to submit. You were supposed to do some research, joint teamwork, and then submit your assignments via Zoom and Skype. At that time, Skype was there. Zoom was not there at that time. So
All right.
it was a wonderful experience for me again.
Perfect, sir. Sir, आप MHP को जाते हुए कहाँ देखते हैं in the next 10 years?
Yeah, MHP is it's flourishing, and I think it's not about MHP now. हम लोगों ने भी realize कर लिया है कि अब दुनिया के साथ अगर हमें चलना है, तो we need to have the best of the best, state of the art technologies. आप देख रहे हैं अभी चैट जीपीटी जो इंट्रोड्यूस हुई है रिसेंटली, मैं भी उसकी बहुत डिटेल में नहीं जाना चाहता. तो वो वक्त दूर नहीं है जब इस तरह की 10 चैट जीपीटी की तरह की चीजें आ जाएंगी, एंड देन अगर वी आर नॉट स्किल्ड, और यंगर जनरेशन, और कमिंग जनरेशन, इफ आर स्टूडेंट्स, हम लोगों ने तो जैसे तैसे टाइम गुजार लिया है, इफ दे आर नॉट appropriately skilled, if they are not, अगर उनको नहीं पता कि चीज़ों को किस तरह यूज करना है, how to use technology, ये सारे tools ही हैं ना, they are all
Yeah,
tools. So
absolutely.
if they don't know as a mechanic of this field how to use, कौन
Yeah,
सा tool कैसे use करना है, तो I think
it has a lot of potential. All
be a
right,
concern all of us.
all right, sir. Sir, now since you're the deputy vice chancellor of a university, not just a dental college, because now you're in a decision-making chair, you can make a difference in a university. What is the one thing you want to change at an undergraduate level for dental students? अगर एक चीज आप change करना चाहते हैं, what would that be as of right now?
ओके, बिल्कुल ठीक आपने क्वेश्चन किया. अल्हम्दुलिल्लाह, अगेन अल्लाह सुब्हानहू व तआला has blessed me with another opportunity, and when I completed my PhD, since I was luckily into administration
Yeah.
a long time back when I was inducted here, so I was doing that I just told you, dental hospitals administration. So I
Yeah.
had that background of administration as well. And you're right that becoming a deputy VC is of course, a key position. And so I think the main, I'll come to your question a little bit later.
Yeah.
Uh, I think the main objective of becoming a deputy VC and in this position to oversee measures to increase capacity and capability uh, 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 in different leadership positions throughout the university. So now I have my scope has broadened, and at that time I was only looking at one faculty, their challenges, their I
Yeah.
mean thing related to dentistry, and now it's the whole university. So again, it's totally a changed world, and I think everything which comes to you, which Allah Subhanahu wa Taala gives you, it is an opportunity at the same time. It's a challenge, but it's an opportunity. I take it as an opportunity, even if
Absolutely.
it's a challenge. And let me tell you, if you take your challenges as your opportunities and
Yeah.
you want to learn from them, then there is, I mean, you can go, the sky
Yeah.
is the limit. So
Yeah.
I think coming back to your question, I think one thing which I would like to change is the methodology. As I said, the way we teach, the way we assess,
Yeah.
it needs to be changed upside down. And now, let me tell you, in our university, we are, Alhamdulillah, one of the pioneers in revising our medical curriculum, and we got it. We were the first ones in private sector in Pakistan. We got our curriculum vetted from one of the best universities in the world, and also in the dental side, we are the pioneers. We moved towards integrated curriculum and modular from the traditional to the newer curricular models. So we introduced these models, and we are still working on that. But as you said, the one thing that we should introduce new things. We should introduce new domains, and which are not specifically clinical domains, because we are teaching, because we don't want to make them clinicians. We want to
Yeah.
make them on the whole experienced dental professionals. And
Yeah.
to become a dental professional, you, for example, I'll come to that maybe a little bit later when it comes to my dissertation, which was in dental education leadership. So I think there are certain domains which are not taught officially at this undergraduate level, like leadership,
Yeah.
like patient safety, like behavioral management. So
Yeah.
it was this what was my thesis as well. So I think I would love to inculcate these domains officially in the curriculum, maybe in the next few years, and hopefully I would like my students to get benefited from that.
Sir, आपके you're a member of many organizations, many associations. आपकी profile पे काफ़ी ज़्यादा organization associations आती हैं, but that has also allowed you to get a very global exposure. इस global exposure ने आपको क्या-क्या skills सिखाई हैं, किस तरह आपको help किया है in your life?
Okay. Ji, Alhamdulillah, I'm a member of a couple of organizations. I'm a board member and a director in UAE. We have a
Yeah.
project of Rifa University. I'm a board member and I'm a director there's it's a joint venture between Records and Academy of Leadership Sciences Switzerland, and
Yeah.
we have established the Center of Excellence by the name of CLIC, Center of Excellence in Leadership, Innovation, and Quality. And the purpose of establishing this center was that we wanted to launch in medical education from that platform, and we are
Okay.
offering a few courses. We also started one of the very we took a very unique initiative by introducing Masters of Dental Education from that platform, and we just completed the first batch was done last year. And also we are offering few coachings and trainings from that platform. Likewise, I'm also part of there's a BMJ leader. It's a journal. I'm a reviewer in that as well. I'm also very recently, there's a ranking system, world ranking system. There are different world ranking systems. So they have introduced a new ranking system in Turkey. So I'm honored to being offered a position as a board member in that as well. So I think the crux of having these global certifications and memberships is that, again, it's a learning for you.
Yeah.
In each and every domain, you face different people, you face different challenges, you meet different people. There are experts in those particular domains. So I got this opportunity to learn from their experiences, and then the beauty of that learning is that then you can always inculcate those experiences in your own environment in where you are working. So it's always a learning process. It's a two-way learning. You
Yeah.
learn from them, and you imply those learning things in your domain. So I think learning never ends. And one thing I would like to mention, that one of my favorite slogans, and which I always remember, and I came across that terminology in Maastricht University when I went there. So
Yeah.
being a lifelong learner, and I think I consider myself as a lifelong learner. Learning never ends,
Learning never.
and the day learning ends, I think that's the last day of your professional career. I think when you
Yeah.
say my learning is done today.
No. All right, perfect, sir. सर आप ये आपके पर्टिकुलर इंटरेस्ट हैं ऑर्गेनाइजेशनल लीडरशिप एंड मैनेजमेंट में. आपने कहा कि आपकी पीएचडी थीसिस भी वाज सम व्हाट रिलेटेड टू दिस एज वेल. अब यंग डेंटिस्ट जो हैं, आप वी कमिंग टू दैट क्वेश्चन दैट यू मेंशन एज वेल, कि यंग डेंटिस्ट सिर्फ क्लिनिकल काम करने के लिए नहीं बनना चाहिए. एक यंग जो अब ये फ्रेश ग्रेड आ रहा है, उस जो नया डेंटिस्ट बन रहा है, ही शुड ऑल्सो हैव लाइफ स्किल्स लाइक गुड कम्युनिकेशन स्किल्स, गुड लीडरशिप स्किल्स, बिकॉज ही नीड्स टू रन अ डेंटल टीम. Even if not that, if he's done his FCPS, he needs to run his department, so he needs to have good organizational skill, leadership skills, management skills. मगर ये वो skills हैं जो सिखाई नहीं जाती हैं at an undergraduate level. आपको over time खुद ब खुद trial and error से सीखनी पड़ती हैं. So what is your opinion about this, and how can you guys as mentors develop these skills in fresh graduates like us?
ऑल राइट डॉक्टर साहब, जैसे मैंने पहले बताया कि ऑब्वियसली पहली बात तो ये है कि कोई इट्स नॉट अ रॉकेट साइंस. दीज थिंग्स अगेन दे आर बीइंग देयर फॉर द लास्ट मेनी इयर्स. इट्स जस्ट दैट आप इसको कैसे, हाउ यू टेक देम एंड हाउ यू वांट टू inculcate them in your students and your next
Yeah,
generation. I
absolutely.
think it's pretty much important. अब जो डेंटिस्ट हम प्रोड्यूस कर रहे हैं, I don't think they'll be fit enough to cope up with the world if they're only expert in clinical sciences or in basic sciences. There are a few essential soft skills जो उनको आनी चाहिए. For example, जैसे मैंने आपको बताया, communication skills, negotiation skills, conflict resolution skills. By the way, ये मेरी बड़ी key areas हैं जो I teach as well. In MHPE as well, and also abroad. I've held different workshops in these domains. So I think undergrad level पे इनको inculcate करना, इनको introduce करना बहुत ज़रूरी है. Inshallah Taala we'll do that very soon. मेरा thesis भी जो था, it was we basically made a module, introduced a module at undergraduate level, and the name of module was BELP. BELP meant behavioral management, leadership, and patient safety. So I think these domains, they are important to be introduced at pretty early level, in early years, even before the clinical years, because you see, as you said, अब जो graduate है, उसको सिर्फ एक clinician नहीं बनना. He needs to manage the department. He needs to maybe manage his practice. So entrepreneurship वाली skills भी
Yeah,
होनी चाहिए. So
absolutely.
all these skills, I think it's a whole, आप कह रहे हैं, it's a toolbox. It's a toolbox जो एक diversity होनी चाहिए. और जैसा मैंने शुरू में बताया था कि जो आप डेंटिस्ट हैं, दे आर, उनको वो एक टेक्निकल, इट्स एन आर्ट्स एंड साइंस, सो they are the mechanics
Yeah,
of the department of the organization.
yeah.
ऑर्गेनाइजेशन लीडरशिप की जब हम बात करते हैं, तो मैंने अभी रिसेंटली एक दुबई में एक वर्कशॉप कंडक्ट की थी, तो मैंने उनको बताया था वहाँ पे, आई सेड दैट ये they are the mechanics and they need to fix if there's a problem, an issue in the organization.
Yeah,
And to fix that issue, they need to have a diversity of tools. तो अगर सिर्फ एक ही टूल के पास होगा, तो वो जो कहते हैं, बड़ा मशहूर प्रभाव है कि अगर अगर सिर्फ एक हैमर ही उनके पास होगी, तो एवरीथिंग विल लुक लाइक अ नेल टू देम.
everything will
सो
look
दे
like nail
शुड हैव अ
biting.
डाइवर्सिटी ऑफ टूल्स अगर उन्होंने आगे फ्यूचर में प्रोग्रेस करना है और उन्होंने आगे जाना है. सो इट्स
Perfect.
वेरी इंपॉर्टेंट. एंड इंशाल्लाह ताला होपफुली we will be officially integrating these domains very soon at the undergraduate level as well, inshallah.
Perfect, sir. That's a beautiful answer. All right, sir. We'll stay on the topic of fresh graduate. If someone like me or many of my friends who are fresh graduates, एक modern day आजकल जो fresh graduate निकल रहा है, to succeed in the practical world, what should the mindset of a young dentist be? उसका mindset क्या होना चाहिए?
ओके डॉक्टर साहब, पहली बात मैं बताऊं आपको कि इस पे भी मेरा थोड़ा सा एक बड़ा वो रहा, एक डिबेट रही इसके ऊपर कि ये जो माइंडसेट, तो मैं भी बाद में आता हूँ, लेकिन जो एक होती है ना काउंसलिंग,
Yeah.
मतलब when I was in third year, when I was in final year, I mean I had no idea where I want to go. Obviously, मेरे mind में तो कुछ चीजें थी, but there was no proper mentorship thing there, and no ऐसा कोई department नहीं था in the university, in the college. वो individual mentors के पास आप चले जाएं, उनसे पूछ लें. So I think ये चीजें भी introduce हमें करनी चाहिए. We have introduced this thing in Rifa. We have a mentor department. We have different mentors. We have a tarbiyah department. So वी पीपल आर देयर जिनके पास आप जाएं, उनसे पूछें, वो दे कैन गाइड यू स्पेसिफिकली. अगर हम स्पेसिफिक डोमेन्स की बात करें लाइक डेंटिस्ट्री, सो आई थिंक दीज थिंग्स शुड बी इंट्रोड्यूस्ड प्रीटी अर्ली लेवल. व्हेन द क्लिनिकल टीचिंग स्टार्ट्स इन थर्ड ईयर, आपको एक डिपार्टमेंट सेटअप करना चाहिए मेंटोरशिप का, जो काउंसलिंग करें स्टूडेंट्स की, उनको बताएं, बिकॉज देयर आर सर्टेन किड्स हु आर स्मार्ट इन क्लिनिकल वर्क. कुछ होते हैं उनके अंदर एंटरप्रेन्योरशिप और लीडरशिप स्किल्स उनकी अच्छी होती हैं. सो जस्ट नीड टू शार्पन दो स्किल्स. वो जो एक हिडन पोटेंशियल है आपको, बेसिकली वो आपको उनके अंदर से निकालना है. सो आई थिंक ये डिपार्टमेंट्स भी एस्टेब्लिश होने चाहिए अब, और उनकी काउंसलिंग पहले से होनी चाहिए. माइंडसेट की आपने बात किया, आई थिंक मल्टी डायमेंशनल एक मल्टी माइंडसेट होना चाहिए. एक ये जो हमने ब्लॉक्स, मेंटल ब्लॉक्स बनाए हुए हैं, बैरियर्स हैं, इनको तोड़ना चाहिए हमें थोड़ा सा. हमें उसका एक, आई मीन, इट शुड बी a mix and match of entrepreneur mindset, एक लीडरशिप माइंडसेट. सो बिकॉज यू सी, आपको नहीं पता हालात आगे क्या आ रहे हैं, क्या आप लोगों को ऑल टुगेदर पीपल माइट नीड टू अपसाइड डाउन शिफ्ट करें, अपनी फील्ड चेंज करनी पड़ जाए. सो यू नीड टू हैव डिफरेंट बैकअप प्लान्स, कंटिजेंसी प्लान्स आपके पास होने चाहिए. एंड इट्स नॉट अबाउट प्रैक्टिस ओनली. आपको, और हर किसी की अपनी रिस्ट्रिक्शंस होती हैं, अपनी प्रायोरिटीज होती हैं. सो डेफिनेटली व्हेन इट कम्स टू एन इंडिविजुअल, ये तो उसकी स्पेसिफिक प्रायोरिटीज पे डिपेंड करता है कि व्हाट ही और शी वांट्स टू डू. बट आई थिंक अगर उनको एक अच्छी बैकिंग मिल जाए, उनकी बेस बनी हो, अच्छी काउंसलिंग उनकी हो, उनको डिफरेंट ऑप्शंस बताए जाएं. यू हैव मल्टीपल ऑप्शंस. अगर आप इसमें जाना चाहते हैं तो ये फायदे हैं. सो इफ दे आर अवेयर ऑफ different pros and cons of different domains, and they themselves, they have a multiple mindset जिसके अंदर डिफरेंट चीजें चल रही हो, they have their plans laid out. याद रखिए, मैं हमेशा अपने बच्चों को, डेंटिस्ट, अपने जूनियर्स को, कलीग्स को कहता हूँ कि always have a plan in your mind. अनप्लान्ड आप नहीं कहीं जा सकते. आई मीन, यू कैन नॉट डू, कुछ भी आपने करना है, आपका एक डेली प्लानर होना चाहिए. मैं जब इवन आई वाज अ स्टूडेंट, मेरे आज भी मेरे स्टूडेंट्स को याद है, मेरे कलीग्स कई दफा हंसते हैं, मेरे बच्चे भी हंस रहे होते हैं. बट with all the technology with me, but I have a diary with me and a pen with me all the time, and मैं उसको मैनुअली भी नोट डाउन करता हूँ. Might looks a bit weird, but still I have my daily planner, I have my monthly planner, I have my yearly planner and 5 yearly planner. So मैंने चीजों को sort out, chalk down किया हुआ है. I've sorted out my things. Rest is up to Allah subhanahu wa ta'ala. You don't know. I mean, man proposes and God disposes. I 100% agree to that. But you should have a plan. वो मशहूर एक saying है ना कि if you fail to plan, you plan to fail. So this is how it goes.
That's beautiful, sir. Sir, whenever I've talked to a lot of dentists on this platform जो clinical practice करते हैं, FCPS करते हैं, but whenever I've talked to someone who's done medical education, or in real life I've talked to someone who's done, healthcare management, or is in a corporate or management position, their insights are always very interesting to me. I really loved that answer. It was a brilliant answer, sir. Sir, we'll be moving towards the end of this interview. I've loved your insights. I've loved this conversation. बहुत मजा आया मुझे पर्सनली. आई एम श्योर स्टूडेंट्स को भी आएगा जो ये एपिसोड देखेंगे. Our last question: what do you think about the startup of ours, and any advice that you would like to give us?
डॉक्टर साहब, लेट मी कॉन्ग्रेचुलेट यू. मैंने शुरू में भी बताया था कि मुझे बहुत ज़्यादा, मैंने जब व्हेन यू कॉन्टैक्टेड मी, तो मुझे, टू बी ऑनेस्ट, मुझे स्टार्टअप को ज़्यादा पता नहीं था. देन आई एक्सप्लोर्ड अ लिटिल बिट. I think it's a wonderful initiative, not on your face. और मैं आपको एक और बात बताऊं कि ये सारी बातें जो मैंने की हैं, I few of the things I see in you as well, and
Thank you so
ये
much.
भी आपका, because you have started this thing, so it's not a traditional mindset. Let me tell you, वो जैसा आप mindset की बात कर रहे थे, you have that mindset, so
Thank
you
you so
have
much,
that
sir.
hidden, you have that hidden thing in you. It was the hidden potential. So maybe we can you can say sharpen, वो जो कहते हैं कि वो स्किल्स को शार्पन करना है, तो वो आपको, आई थिंक
इस चीज के
इट्स
लिए
अ गुड. जी, सॉरी, प्लीज गो
सॉरी
अहेड.
टू कट यू सर. इसके लिए मैं वंस अगेन, जिस तरह आप कह रहे हैं ना कि एक अच्छा टीचर होना बहुत जरूरी है, जो आपको मैं आज तक सोचता हूँ कि मैंने ना सबसे पहले जाके, आई डोंट नो इफ यू नो हिम, डॉक्टर नासिर सलीम है. ही इज
जी, आई नो.
या ही इज़ अ डेंटिस्ट हियर इन सीएमएस टोर ऑपरेटिव डिपार्टमेंट में हेड ऑफ डिपार्टमेंट है। मैंने उनसे जाके पूछा कि सर मैं ये शुरू करना चाहता हूँ, मैं क्या मतलब मैं शुरू करूँ ना करूँ। आई वाज वेरी डबल माइंडेड अबाउट इट कि मैं करूँ ना करूँ, लोग क्या कहेंगे, सोच रहा हूँ, बहुत ओवर थिंक कर रहा हूँ। बट फिर सर ने कहा कि नहीं करो, कुछ नहीं होता, बड़ा मज़ा आएगा तो ये करो। उन्होंने मुझे मोटिवेट किया। अगर वो उस दिन मुझे कह देते कि ये क्या बकवास है, ये ना करो, तो मैं कभी ना शुरू करता। So आज तक मैं सोच रहा हूँ, it's very important to have a good teacher by your side who's ready to help you and ready to motivate you.
सर्टनली। और मैं आपको बताऊं कि जैसा आपने ये प्लेटफॉर्म एक लॉन्च किया है और इसमें आप डिफरेंट लोगों के साथ, मैं कल अभी टू स्टार्ट विद अभी आप सिर्फ डेंटल प्रोफेशनल के साथ कर रहे हो, मगर आई थिंक आई वुड सजेस्ट कि आप इसको थोड़ा सा एनहेंस करें, इसको आप इंटर प्रोफेशनल, इसको आप इसका होराइजन ब्रॉड करें, टेक इट टू हेल्थ प्रोफेशनल्स, और फिर आप उसको थोड़ा सा, आई कैन हेल्प यू विद दैट एज वेल इफ यू वांट। और आप इसको इंटर प्रोफेशनल, क्योंकि अब इट्स अब जमाना जो आ रहा है, फ्यूचर इज अबाउट इंटर प्रोफेशनल एजुकेशन।
बिल्कुल
अंडर वन रूफ आप दुनिया में देख लें, इट्स फिजियोथेरेपी, मेडिसिन, डेंटिस्ट्री, नर्सिंग,
बिल्कुल
वट एवर, ये बच्चे, ये दे आर स्टडिंग टुगेदर, एंड डिफरेंट टास्क हैं, चैलेंजेस हैं कम्युनिटी के अंदर भी, दे आर गोइंग देयर टुगेदर, सो इट्स अबाउट एंड लर्निंग फ्रॉम ईच अदर। सो आई थिंक इट्स अ ग्रेट इनिशिएटिव, आपको थोड़ा सा इसको एनहांस भी करना चाहिए।
yeah,
और मेरी बात एक आपने शुरू में की, मुझे बड़ी उसको अच्छी लगी कि कभी भी इंसान को रिस्क लेने से नहीं घबराना चाहिए। आई मीन ये फिर एक पछतावा आपको रह जाता है कि अगर आपने ना किया होता आपने,
yeah,
तो यू शुड रिग्रेट इट, बिकॉज वो आप, इट्स ऑलवेज अ लर्निंग, इवन इट्स इफ यू फेल, you'll get a lesson out of that. So it's not a loss by any means. It's always a, so trying new things. I myself, as I said, I love to try new things. I love to think out of the box. I love to take risks.
yeah,
ऐसा क्या होगा, ये फेल हो जाएंगे आप,
yeah,
डजंट मैटर। सो अल्लाह
yeah.
ताला ने कोई और आपको प्लान किया होगा, बट
Perfect
आपको
sir.
एक्सपीरियंस मिलेगा, आपको एक नई डायरेक्शन जरूर मिलेगी, यू विल गेट अ न्यू, आई मीन आपका उसमें आपको, इट विल ऐड टू योर विजडम, इट विल ऐड टू योर एक्सपीरियंस, so it
Perfect.
will be a benefit for you at the end of the day.
Perfect sir. Sir, thank you so much for taking time out. This interview meant a lot to me. बहुत कुछ आपको आपसे सीखने को मिला। I'm sure हमारी audience को भी सीखने को मिलेगा। Thank you so much sir, and take care and have a nice Ramadan.
Thank you so much. Thank you so much. It was a pleasure, and I'm honored to be here and looking forward
Thank
to
you so much.
meeting you someday face to
Inshallah sir.
face.
Inshallah
Inshallah.
sir.